All right. Well, welcome, Jessica, Dr. Jessica Konopka, and Dr. Michele Desimone, or Desimone. How do you pronounce it again?
Michele Desimone.
Desimone. There we go. It was very nice to have you both here. I'm very excited to learn more about what you do, Dr. Desimone. I know Jessica a little bit already. I mean, we're pretty good friends, and so I know a lot about what she does, but I'm very interested to learn about what you do, Dr. Desimone. And so I want to first start by introducing everybody, so everybody, we all understand kind of who we all are. I'm Tony Pajunen. I'm a certified health coach. I studied with the Institute of Integrative Nutrition, and now I have a health and wellness business. I specialize in helping people and wellness professionals help their clients avoid replacement surgeries and transform their mobility, and also help them look better than they did 10 years ago. So it's very fulfilling work. And I do work together with Dr. Konopka, Jessica, who she is an orthopedic surgeon and physician. She's a published scientific author, and she's a nutritional and lifestyle coach. And so she has a lot of things going on in her life. Very talented and very smart individual. Also working on things that are even patented currently. So I can't even go into all the things that she's doing, but she's very amazing. And Dr. Desimone, you are a doctor of speech pathology and also the director of the sensory studio where you are currently located right now, where you're having this interview, right?
Yes, exactly.
Great. Well, great. So Dr. Desimone, as I mentioned, I want to make this about this process, about what you do here. And I wanted Jessica to kind of start a little bit, I think, and you just, I want to kind of step back a little bit to kind of see where did you want to start in terms of the discussion today?
Dr. Desimone, thank you very much for having us and for this wonderful meeting. And thank you, Tony, for moderating our interview and for introducing everyone so beautifully. I think we can start from asking Dr. Desimone a little bit about herself and what she does. Would you be kind enough to
Sure.
let us know?
Thank you so much for having me. It's really a pleasure. I've come to learn so much about you, and I'm always enamored by your wealth of knowledge. And I'm really, it's such a pleasure to be able to meet Tony and be involved in this process to help other parents.
Thank you.
So I'm a doctor of clinical speech language pathology. I own the sensory studio. When I was young, I had a cousin who was deaf, or actually hard of hearing, not completely deaf. And he had a speech language pathologist who he worked with for years. And he was about 3 years younger than me. So he was started as my peer, and little by little, as I've come to know that he was struggling, and his parents came to learn that early intervention helped him. And then he moved through the process of the Department of Education, getting health and hearing services from a speech pathologist. He eventually had hearing aids, but I watched the speech therapist really train him to be able to communicate and to read lips and improve such a huge part of his life. And it really had a huge impact on me. And that was the root of where speech pathology started for me. Beyond that, I went to school for speech pathology. I graduated with my master's. And before going for my doctorate, I started to do some clinical work. And I worked within an agency that provided services through the Department of Education. And when that happens, you're functioning under the guise of it's called an individualized education plan. So it's a very specific plan drawn up for the children that lists out very specific goals. But because the funding is rooted in the education system, all of the goals noted must be very closely related and directly targeting educational goals. So if a child had a fluency disorder, difficulty with stuttering, which from my perspective is a huge issue and the child definitely needs support and services, it's not always covered under the Department of Education plan. So I felt very limited in the way that I could help children. And so I worked for about 7 years and then another 4 years providing services that way. And it really just continued to make me feel bound and limited. And I felt like I wasn't doing all that I could for those children. So I eventually gathered up my resources and I opened this place called the Sensory Studio. We offer speech and occupational therapy. We started that way, but we also now offer a range of other services. So we help to coach parents, we help them to understand the disabilities that their children have, and we help them to see the potential in their children. And I think that's really one of the main limiting factors that I was restricted by within the Department of Ed was access to the parents. So it was a very much go into the classroom, take the child, work with the child for 20 or 30 minutes, and then return the child to the classroom. We were guided not to give referrals, not to meet with the parents. So it was a limiting way of treatment. And here, over the course of now we're almost open 8 years, it has been such a process of no limits. We've come to really be able to offer such a wide variety of services based on the specific need of what that child and what that family needs. And even if it's not us providing the service, we're often referring out to specialists and growing our network to really be able to provide the services that the child needs.
That's phenomenal. That's phenomenal. Very inspiring story, and also I'm very pleased to be a part of this whole process, because the intention of our meeting today is actually to give parents this notion and this reassurance that such places as Dr. Desimone's Sensory Studio exist, and they're very active in the community, and they provide this plethora of resources available to parents to integrate the care and the specialty therapeutics that children need. So this is fantastic, and we want to let parents know that that basically we, first of all, this very multidisciplinary approach is the best way to address certain issues that children are presenting with. We've had the pandemic. The pandemic has also, brought about so many different stressors in our society today, and many different situations are arising, also clinically in children, and children especially, but also adults. So we want to treat the family as a unit, basically, and we want to give families resources to basically ameliorate their lifestyle, ameliorate their environment, diminish their stress, increase, let's say, nutrition.
Certainly.
So that's the goal of our meeting today, basically. So Dr. Desimone, so what kind of therapeutic support does the Sensory Studio provide specifically?
So here we offer speech therapy and occupational therapy. We offer both of those services simultaneously in joint sessions and also separately. In addition to that, we offer peer socialization groups because prior to and after the pandemic, we're seeing peer interaction just have a huge effect on, well, the children's difficulty to interact with peers is really significant.
Tony, let's have you join our discussion, please.
Yes, that's so important what you're doing, because COVID really I think nobody can argue with the fact that it affected children in a huge way, whether or not they actually got COVID or not. It's the social ramifications of not being in school, having to, social distance and all that stuff. They missed out on so many social events, graduations, even, like things funerals, things, significant parts of their life that they weren't allowed to attend. So it's very good that you're cognizant and you're really there to support these kids who, I think really there more and more services like yours are needed right now in a huge way.
Sure. I think a lot of parents are relying on us much more. And we've seen, I mean, our practice alone has grown significantly since the pandemic, which is a sad thing, but also it's great that we're here as a resource to the community.
Absolutely. If I may ask another question, what are the most common symptoms that children present with coming to your center? And what are the needs of the parents?
So very often, children are referred to us most commonly through the pediatrician. So a parent will bring their child to the pediatrician. The pediatrician will do a series of mild assessments, and then end up saying, okay, well, your child's not talking, so why don't you go and get assessed for speech therapy? I think that often the pediatrician is seeing something else, but it's difficult for the family or difficult for the pediatrician to share with the family anything further than your child's not speaking. So that's the simplest route. So very often pediatricians are referring to us, who know, a lot of the pediatricians here in our community know that our center is very comprehensive. So we're never going to just treat a child for a lack of expressive language, but rather we're going to see the child as a whole and really look at the whole child. So we're going to help coach the parent. We're going to inform the parent of any resources available and the need for anything beyond just expressive language issues or receptive language issues. So the child comes to us, and we are most often seeing a self-directedness. So that's a term that even some providers haven't heard. Self-directedness is basically the child enters a space and doesn't see or notice the people in the space, but rather notices the items and the floor. And they move through the space in this almost in a fog. And a lot of parents describe it that way to me, in a fog. And they often say, can you pull my child out of this fog? So behaviorally, we can do that. But there are a lot of additional factors like nutrition and supplementation, and also, you know, behavioral factors within the household that have a huge effect on the child. So going back to your question, I would say self-directedness, fleeting eye contact, a lack of responding to name, limited language skills. Very often I'm seeing children who have extreme abilities to have visual memory, and they are recognizing and memorizing letters and numbers and symbols and logos, but they're unable to interact in a reciprocal conversation. And those are the clues that really lead us down the road to seeking additional help.
Absolutely. That's very fascinating, and it's very important to you know, be very aware of these symptoms and bring the child to the appropriate specialist as yourself and your wonderful team of occupational and speech therapists, as early intervention is basically key to preventing perhaps the further progression of the symptoms into more severe let's say clinical situations. So what kind of specialists do your patients work with, if you can tell me?
So we're often referring to ENTs. We see that there's a definite connection between breathing well, sleeping well, and eventually being able to learn. So that's one main factor. Also, there's maxillofacial specialists that are looking at lip and tongue tie now, phrenectomies. We also, a lot of our patients are seeing nutritionists, chiropractors, often also gastro doctors, really to focus on the gut and see what nutritionally can we do to identify the problem and then hopefully work towards restoring it.
Absolutely, that's quite critical. And what advice would you give to parents that are at the beginning of this process? Because that's very important, like leading the parent who.
Sure. So I think a lot of the parents that are coming in are coming with a mindset of, my child's just not speaking, you're the speech pathologist, here you go, please fix the problem. And the issue that arises on our end often is that if I set your child up with speech therapy 2 or 3 times a week for 30 minutes, those 3 30-minute interactions are not going to change your child. They're going to help to elicit language, they're going to help to model language, but it's really the parent and the caregiver that has all of the other time with the child that's really going to be able to make the difference. So we're not only treating the child, but we're also coaching the parent on what can the parent do to improve their elicitation of communication and their modeling. It's called motor mapping or scaffolding. Scaffolding is adding to language. So if the child points and labels car, the parent might say, yes, that's a car. What does the car do? The car goes. Let's make the car go. Can you beep the horn on the car? Beep, beep, beep. So scaffolding is adding layers to the single or two-word combination that the child initially provided. So the coaching, I think, is a really important part. Advice for the parents really would be to convey to them that they are the largest part of this team and that they really need to work to learn to advocate for their child, and they need to learn to actually become a provider themselves for their child. So not just a provider financially and service-wise, but actually identifying, helping helping the clinicians to understand their child better, because we are only with the child for a very limited time, while the parent is the person who really sees the big picture of who this child is and where the child struggles. And then additionally, not only helping the clinician to identify, but utilizing the clinician's expertise to learn how to work with their own child in the home during mealtime, during playtime, what situations might be healthy for their child and what situations we want to avoid, like certain devices. And we really try to avoid one-way interaction. So a child watching a video on YouTube is a very one-way interaction. And often what we're seeing in the difficulty children are having is difficulty with reciprocal language. So during the pandemic, many children sat in front of a television because parents needed this electronic babysitter because they were working remotely. And often what is happening is the children are only learning to take information in, but they're not learning to be reciprocal. They're not learning to turn take and to answer questions and then also ask another question. So for the parent, I think the main idea is you are the advocate for your child. You're the leader of the team. You need to dig a little bit deeper and know that you are a huge participant in the clinical team for your child.
Fantastic. This is exactly what I wanted to actually ask, because this is, it's a wealth of knowledge that you're presenting, and we're so incredibly grateful to have you and have this discussion. And we want parents to know that places like the Sensory Studio are available to of course, provide all the resources and information and guidance that parents and children need. And what kind of take-home message would you tell our viewers today?
I think, you know your child. So you need to know that your child has so much potential, and you are the one that's going to guide all of the clinicians toward that potential. So any little tips that you have for those providers, any clues that you can give the team on different elicitations, different motivations. So, a basic part of therapy is that we're not going to get a lot out of a child and make progress unless we're seeing the motivation that the child that actually moves the child toward the goal. So if playing in a large sensory gym is motivating to the child, then eliciting some language with the sensory gym as a reward is going to motivate the child to move toward that goal. So I think some takeaways would be to identify what motivates your child and then utilize that motivator in a strategic way. Don't just, if the iPad is motivating for your child, don't just make the iPad available all the time, because then it lessens the impact of the motivation. You really have to identify what is going to compel your child to move forward, and know that you are the leader on that team and you're the one that's going to drive this force. Finally, I think I would say that you really shouldn't just accept what's being told. You have to dig deeper. You have to seek guidance, trust the clinicians that you're working with, but know when you know better and know when to dig deeper.
It's fantastic. Thank you so much, Dr. Desimone.
Of course. Thank you so much for having me. It was such a pleasure.
Thank you. And thank you, Tony,
Yes.
very much. And would you like to take over, please?
Yeah, this was amazing. I learned so much, and I'm so glad that you're doing what you're doing. And thank you again for being with us here today. And if you have any final kind of like words of wisdom or anything, I just have a question that kind of came up in terms of like, what have you considered, because you were talking about how the parent is so important in this process. Have you considered like a dual kind of session where the child is coached, but then also the parent is coached at the same time? Something like that.
So there are often sessions where we will Zoom with a parent in order to give coaching to the parent while the parent is actually the one working with the child.
Right.
We also have set up sessions where, so in the beginning, when we first start to work with a child, there are often behaviors that stand in the way, right? So there are a lot of behaviors that were created in the home because the home is a less structured environment.
Right.
So the child is used to having their way and used to their own routine. And that here, when they come to this center, we have a benefit of really creating structure and boundaries with motivation and reward as the reciprocal force. So I think, you know, we have to always keep in mind that the child needs to have a motivation.
Right.
And when we move past the behaviors, so there are often, the behaviors presented are often avoidance behaviors. So there are non-negotiables. Okay, it's time to brush your teeth. The child is very sensory defensive, does not want the parent in their mouth. The parent panics and backs up and shows the child that they are fearful of this situation. And then the child picks up that cue and also becomes more fearful. And it's a cycle. So what we do often is we coach the parents that a non-negotiable is a non-negotiable. And your response to your child is often what teaches your child how they should feel. So if a child is afraid of the running water in the bath and the child screams and the parent backs up and screams too, you're reinforcing in the child that, yes, you should be afraid of this. Right. Instead, you know, a great psychologist once said to me, sometimes we have to use our Hannibal Lecter voice as parents. And so really what she meant was, as the child is kicking and screaming on a non-negotiable activity like a bath or teeth brushing or eating a meal, we sometimes just have to stay as calm as possible and say, it's okay. I understand that you're afraid of the running water. The sound is loud, but it's okay. It's fine. You're safe. I'm here with you. You're going to be fine. And while I'm saying this in this very calm voice, the child may be kicking and screaming and punching. And I'm trying as hard as I can to stay very calm and scoop him in and give him comfort, but not avoid the activity. So when we, the parents, move away from the activity, it reinforces this, it's okay to avoid. And actually, that's the opposite of what we want to do. So when a child starts here at the studio, we have a lot of undoing that we have to work on. We have to really insist that the child move toward the things that are difficult for them and move toward what they tend to avoid in a safe environment with a lot of verbal support, with a lot of, I'm here with you, validating their fears and worries, their anxieties, but continually in a very slow, faded way, pushing them toward what's uncomfortable. It's really, that's what therapy is.
That's amazing. And I can tell by the way you're talking how clear you are getting results. I can just tell, I can hear it in your voice that you're getting results with these children and the parents, which is amazing. And I'm so glad. And I just, it's so moving to see that you're doing this, because, you know, there's so many people, parents and children, who really could use your services, especially today. And the fact that you're so effective in doing it, and you have such a clear roadmap, because everything you just said makes 100,000% perfect sense, you know, with your approach. So it's just very, very moving, like I said, to see that you're doing so much good for the world. And so thank you so much again for being here. And if you have any other closing bits of wisdom, you know, it would be great to hear them. And then
Thank
after,
you so much.
yeah,
I'm so inspired by you both, especially
You have been our inspiration, actually, Doctor.
you've come so far, and I am, you know, grateful for all that I've learned from you and the ability to really share your knowledge with the other parents in our network here. You know, that's the goal.
It would be our pleasure to collaborate, Dr. Desimone. Thank you once again.
Thank you. Thank you so
Yes.
much.
Thank you so much, and have a great rest of your day. And
You
we'll
too.
hopefully, you know, we can talk next time again, right?
Terrific.
Thank you.
Talk to you later.
for having us.
Thank you. Thank you so much for coming. Talk to you later. Bye.